If your period keeps getting in the way of your skin goals, this is the video for you. Breakouts surrounding your menstrual cycle can undoubtedly be controlled if you just learn how to sync your skincare routine with your menstrual cycle. So if you are over having hormonal breakouts or period skin, please give this video a thumbs up and make sure you're subscribed to the channel. Please share this video with anyone that you care about that is struggling with their skin, because I want as many people as possible to be confident in their skin, to be able to clear their skin, restore their confidence, and find their inner Wonder Woman. You, my friend, may want to grab a pen and a piece of paper because this technique works, period. Hi beautiful people, I'm Dr. Alexis. Welcome to my channel, or welcome back to my channel. Quick disclaimer, this particular video is to help those with ovaries, because we're talking about how to sync your skincare with your menstrual period. I am a board certified dermatologist, but I have a background in cosmetic chemistry. I take a very holistic approach to skin health in general, and I put my patients who are suffering from hormonal or cystic acne on a strict skin detox. Also, we go through how to sync their skincare regimen to their period. I have seen this method work time and time again. So many of my patients start to notice an improvement in their skin within 2 weeks, and I want you to be able to receive those same types of benefits as well. We're going to talk about something that is literally going to change the skincare game for you if you suffer from period acne or menstrual cycle related breakouts. You don't need me to tell you that menstrual cycles cause breakouts to happen well beyond the teenage years. In fact, female adult acne is on the rise. It causes a lot of anxiety and depression and just a lack of overall confidence. And it doesn't have to be this way. 80% of the adult female population struggle with hormonal breakouts. And this is, of course, due to the hormonal fluctuations that happen with our menstrual cycle. Even if you're on birth control, you still can suffer with breakouts. Skin changes during that time of the month stem from hormonal fluctuations. So basically, our hormones are messing with our sebaceous glands. This causes more oil production, which causes increased inflammation and a thriving environment for C. acnes bacteria to grow. In addition, the hormones actually change how things are supported within the dermis of our skin. So all of the things that we don't want happening. So basically, these hormonal changes are messing with our skin's ability to stay clear, dewy, youthful, wrinkle-free, and they mess with our overall glow. Your skin is indeed a window to your health, and this magical mirror deflects what is going on not only at the hormonal level, but also what's going on in our liver and in our gut. So it's really important not just to learn how to sync your skincare routine to your hormonal pattern, but really important to know what to eat and what to avoid to help with inflammation around your menstrual cycle time. Now, your menstrual cycle is divided into 4 phases, and therefore your skincare should also be divided into 4 phases. If you've got not a clue where you are in your menstrual cycle, there actually is an app called Clue. There's another one called Flow. There's lots of free resources on like Kotex and Playtex.com where you can actually put it in a few details and they will help you track your menstrual cycle. So you can know exactly where you are in your menstrual cycle, which phase you're in. Therefore, you can learn to appropriately sync your skincare to your menstrual cycle. Phase 1 is the menstruation phase, or the follicular phase. So this is the week of your period. And specifically, it is day 1 through day 5. So day 1 is the first day of your period. This is the most sensitive your skin is all month long. So you want to make sure that you are concentrating on gently nourishing your skin. Your cleansers should be gentle. You want to use things that are going to be nourishing and hydrating. Think CeraVe Hydrating Cleanser. You definitely want to avoid things that are formulated with harsh cleansers or strong exfoliants during this time. This is because that estrogen surge the week of your period drops your skin's natural moisturizing factor, leaving the skin extremely sensitive, dull, and dry. So you want to make sure that you're using products that reflect this really crucial change. This would be a great time to do a nice restore and recovery gentle mask, like that oatmeal mask that I showed you in a previous video. It is anti-inflammatory, it's moisturizing, and it helps to restore the skin's natural moisture barrier. If you're on a retinoid, you may want to skip a night or two because your skin is extra sensitive right now. And if you suffer from post-inflammatory hyperpigmentation, PIH, or dark marks, you may notice that it's actually more intense during this period of time. On a positive note, you are most likely noticing that the pimples that occurred the premenstrual week or that week before your period are finally starting to clear up. So really, day 1 through day 5, and remember, day 1 is the first day of your period, you're focusing on gentle cleansers, oil-free moisturizers, and antioxidants to help your skin to rebound, recover, and restore from all of the inflammation that occurred the week prior to your period. All right, so moving on, we're now on day 5 through day 7. We're still in that phase 1, but we're at the tail end of it, and your skin is becoming even more dry now because of the continuous increase in estrogen. Because of the increase in dryness, you may want to add something like a hyaluronic acid booster to your moisturizer so that you can get even more benefit out of your moisturizer. Remember, your skin needs to be damp before you apply hyaluronic acid to get the most bang out of your buck when you cap it off with a final moisturizer. Okay, so moving into phase 2. Now, this is still part of the follicular phase, but it's known as the proliferative phase. It's day 8 through day 13, and this is the best time because your skin is at the best it's going to be all month long. It is serious selfie time. So just remember that right after your period and until you ovulate, so day 8 through 13, this is when you want to schedule any kind of photo shoot that you may have or any kind of event that you have coming up because your skin is going to be at its best. So while your skin is more hydrated and glowy, you may notice that your pores are a bit more visible here because your sebaceous glands are a little bit more active in this phase. This is a great time to resume your retinoid if you discontinued from the week before. It's also a really good time to use your active ingredients. If there's something you have been itching to try, this is the best time to do it because your skin sensitivity is down. And day 14 is the usual average day for ovulation. Now we're on to phase 3, so this is day 15 through day 24. So basically the week right after your ovulation. My friend, things are starting to take a turn for the worst. You're probably going to want to incorporate salicylic acid or glycolic acid during this time, so get your exfoliators out because progesterone is up, which means that your sebaceous glands are now secreting more oil again. So we want to help to protect and defend and detect things that are going on in the skin so we can really get in front of them to decrease breakouts. So you want to use things that are going to help to exfoliate the skin, decrease oil. You guys know I love salicylic acid. It's a great time to start incorporating salicylic acid into your daily routine. I really love the Naturium BHA 2%. It's fantastic to go ahead and use every day during this period. If you are someone who is getting facials, this is the ideal time to do it. So right after ovulation, day 15 through day 24 is a great time to schedule your facials. It's a really good time to do the Diamond Glow. That is that machine that's like the vacuum for your skin that extracts, exfoliates, and infuses serums all at the same time. There's actually a salicylic acid infusion that you can get. This is going to help to clear out those pores and keep everything nice and clear for the upcoming week. Okay, my friends, we are now into phase 4, which is day 25 through 28. We're still in that luteal phase, which includes day 15 through 28, but phase 4 is the worst skin changes. This is that premenstrual skin that everybody who suffers from hormonal acne knows all about. It's when you start to get the cyst and the acne around the jawline and on the chin, and it's just not very forgiving. It can even be quite painful and leave you with dark marks. We need to do everything in our power to get in front of this period. So if we've done everything right up to this phase, we have set up our skin optimally to get through this phase without a big flare. What I want you to do is realize that your oil is revved up, which makes C acnes very happy. What we want to do is actually calm the oil down. It's a great time to do something like a clay mask, and specifically a sulfur clay mask would be fantastic. It will help with the acne. It's anti-inflammatory. It will help to decrease the oil production. There's so many benefits of a sulfur clay mask, but you want to be careful and make sure that you don't have any sulfur allergy. And if you are constantly suffering from cystic acne at the jawlines or in the chin, you may want to consider adding a benzoyl peroxide at this moment too, to really help to calm down those C. acnes. Okay, so this phase, it is super important that you focus on skincare ingredients that are known to be anti-inflammatory. So things like arnica and aloe would be really great to make sure that they are incorporated into your moisturizing ingredients. Make sure that you are avoiding ingredients that are known to cause more inflammation, like fragrance or oxybenzones, which are found in sunscreens, or formaldehyde or even formaldehyde releasers. These things are going to make your inflammation worse and cause more acne. And while I'm sure you may not feel like it right now, my friend, I want you to get up and sweat. Exercise will help to decrease your cortisol level. It's going to give you a cortisol flush. Now, if you've decreased your cortisol, which means that you are helping to manage your stress, you are getting rid of that chronic inflammation that can occur literally head to toe. So not only will your skin feel better, but you will also feel happier. Managing your cortisol is key to many things in life, but is definitely helpful for your skin as well. The week before your period, hyperpigmentation is at an extremely vulnerable phase, so you want to make sure that you're being extra diligent about your sun protection the week prior to your period. During this phase, it's especially important to eat a diet rich in anti-inflammatory foods. You want to avoid foods that are known to cause more inflammation. So things like sugar, refined and simple carbs, fried foods, gluten, overprocessed, overcooked foods. These are things that you want to avoid during this phase. A lot of these comfort foods raise insulin, which then raises inflammation and increases oil production. In addition, it makes your skin more sensitive to the androgen hormones that worsen acne. And you know what does this to an even greater extent? Dairy. So let's just take a moment of silence for dairy. Dairy, may you rest in peace. If you have hormonal cystic acne, there is no place for dairy in your diet. It is super important to heal the skin from all angles, guys. So my next video is actually going to be on a skin detox plan that I give my patients suffering from hormonal cystic acne. It works tremendously, but it's a whole video in and of itself. So you want to make sure that you don't miss that one. Subscribe and hit your notification bell. Pimples and zits are just symptoms, guys. You don't want to just chase the symptoms. Treat the symptoms. You want to treat the root underlying cause, whether that is hormonal fluctuations or dysregulation in your gut, the way your liver is running, are your bowels moving, what you're eating, what you're not eating, are your cortisol levels elevated. There are so many things that go into having clear, radiant skin. It's really important to dive into that, and that's what we're going to talk about in the next video. You can't fix some of this stuff with creams, potions, lotions, and cleansers. You really need to dive within and clear your skin from the inside out. So we'll talk about that in the next video. Please give this video a thumbs up and subscribe to the channel if you enjoyed. I will see you next time, guys. Be well.